I just want to clarify my last video because I think I left out a few key words. I wasn't at the hospital to treat ME/CFS in general. I was there to treat an infection and blood clots. And I went over that in the previous video I made about my experience at the hospital. But I would never go to the hospital to treat general ME/CFS, unless I had to, unless I had no other place to go. And some people, wind up without any other place to go, and they have a terrible experience because the hospital is like, ME/CFS, or they're like, ME/CFS, I mean, and all of our needs are ignored, and they have no idea how to make us better. But I was there for an infection, sepsis, and blood clots, and those two things the medical system knows how to treat really, really well. There's been tons of studies on sepsis and infection in general, and blood clots, and there's multiple drugs out there to treat blood clots, and there's been long-term studies on those drugs' effectiveness and the outcomes. So when I went to the hospital with those conditions, they did tests, and they figured out that's what was going on. And then it was like this I could just see this machine just sort of go into action, and that's what I was talking about. It was amazing to feel, because it was working for me, that part of it, the treating the infection and sepsis. And it was just like, they figured out what was wrong. They figured out the best treatment options. They put those treatment options into motion, and then they gave me a really accurate assessment of how long it would take for me to recover. And they were really knowledgeable and sort of in control and comforting, because this is something that a lot of people deal with, and they knew how to deal with it. They're clueless about ME/CFS. At how the whole medical system is clueless about ME/CFS, but being treated by the medical system in that way, where they just knew what was wrong with me and they knew how to treat it, was amazing. And it was like I said, it was just so cathartic, and I just really wished that I could be treated like that for ME/CFS. And I really hope someday that all of us are treated that way by the medical system, because that's what's just, and that's what we need, all of us.